Recording in progress.
Good morning, everybody. Thank you for joining us. As some of you might know, I'm Tony from McLaren St. Family Medicine. As we do the third Wednesday of each month, give a talk on a different medical topic. And today's a topic on Parkinson's disease, which seems, and we were talking about this on the drive out here, is just becoming a little bit more and more prevalent. And today we have Dr. Sherry Magray, who's one of our second-year residents, as well as Noah Pack, who is our pharmacy resident, that are going to tag team on this presentation and talk a little bit about Parkinson's in general, some of the causes, some of the signs and symptoms. That Noah will talk about medications and then kind of bring it back together. But there's a lot of information here that we think you'll find very useful, very helpful. So I'll turn it over to Dr. Magray, and we'll stick around at the end in case you have any personal questions.
Thanks again for having us. Sorry, I'm not standing because I broke my foot, so bear with me, but I'm really excited to be here today and talk to you about this important topic of Parkinson's disease. So we'll just start kind of basic. A lot of people say, what is it? What is Parkinson's? You probably hear about it. Michael J. Fox is probably one of the most famous people that's had Parkinson's. He's had years and years now, and there's a whole Michael J. Fox Foundation, but what is it? So the fancy word your doctor may use if they're talking about it is it's a neurodegenerative disease. And what's that mean? Basically, the nerve cells in the brain break down. They degenerate, all right? So they're not as good over time. And there's a chemical called dopamine that's really, really important in the brain. And as these nerve cells break down and the brain goes through these changes of essentially breaking down, your body will make less and less dopamine. And that's a problem because dopamine is a chemical that basically controls our ability to move, right? And so, you probably heard that Parkinson's has people with shaking, right? Or tremor is what they talk about a lot. And why does that happen? Because the body isn't having enough dopamine produced to help us properly move anymore. All right, it gets kind of complex, but that's the bottom line. What exactly causes it? Like most patients, if you tell them they have it, like, well, what caused this? The truth is we're not 100% clear. There's a few different ideas. Some people think it could possibly be due to genetics. So you have a gene, maybe, and there does seem to be like a higher incidence of Parkinson's if you have a first-degree relative. So if your dad had it or your mom had it, or you have a brother or sister who had Parkinson's, you tend to have a higher risk of having it. Doesn't mean that you will, but it tends to be a higher risk. The issue is we don't know exactly which gene causes this. So if we knew that, we could do a test for it, but we don't know which gene causes it. So we're not 100% sure. Some people say, well, maybe Parkinson's is caused by like exposure to chemicals, like pesticides or things like that. And that's another good theory that people have talked about. But again, we don't really know for sure. We do know that the #1 risk factor for Parkinson's is no one can control, getting older. Right. So as you age, it tends to be that we see more and more cases of Parkinson's disease. That's kind of what we know about the cause. So we're not 100% sure, but those are our three best guesses. We know increasing age, we know possibly some genes, and we know maybe some exposure to chemicals is our best thought at this time. And there is research going on, for Parkinson's disease. So what should you notice? What would you be aware of? The interesting thing about Parkinson's is there's like a lot of symptoms, and some are related to movement and some are not. And what most people think of is, like we talked about, the tremor. Sometimes people get tremor in their hands. They call it a pill rolling tremor. Sometimes you'll see people just kind of start to shake. You'll kind of see this sort of thing. And people often have difficulty walking. So you'll notice that people are kind of more stooped over. They kind of bend more at the waist when they walk. And they often get a short shuffling gait. And I would do it for you, but I can't. But they get a short shuffling gait. It looks like they're taking tiny little steps. Yeah, and then at the end they get faster and faster and faster as they're trying to continue to walk, but it's just hard for them to do it. But that tends to actually be some of the later signs of Parkinson's. People get rigid. If your doctor takes your arm and just bends it like this for you, what you'll notice sometimes in patients who have Parkinson's is they have what they call a jackknife movement. So they kind of go like this and they go like this, and then all of a sudden at the end, it gets really fast. So it's kind of weird, like it's slow, and all of a sudden it jacks like a knife at the end. So those are things that doctors look for. People often say they're tired, they have a hard time moving, because basically your muscles get rigid as you're not producing enough of the chemical that controls movement. So that's what people notice. Those are often later signs. And it's interesting, that's what everyone thinks of with Parkinson's is trouble moving, shaking, tremor. But there are some early signs, and that I know the Michael J. Fox Foundation talks about sense of smell. And there's been a lot of news about this over the past few years about Parkinson's patients often lose their sense of smell. Almost all of them at some point have their smell affected. And so that's an interesting thing, because most doctors, when you go to the doctor, they don't check your sense of smell, right? We don't do that, but maybe we should. And so I know there was discussion about peanut butter in particular, that if you could not smell peanut butter, you were much more likely to have Parkinson's. And it's an interesting thing, but I know there was some research on that, and I know the Michael J. Fox Foundation offers scratch and sniff cards. Like if you went on their website, you can request them to test your smell out and see how you're doing. So it's something to think about. Some people get depressed, some people get anxious. Now there's a lot of reasons for depression and anxiety in a lot of people's lives. It doesn't mean if you have depression or anxiety, you have Parkinson's, but it's something to, if you're having depression and anxiety, you're losing your sense of smell, you're starting to have some tremor, then your doctor might say, oh, okay, maybe we should think about this. So it's basically really important to talk to your doctor if you think you're having some changes. Other things that maybe people don't think about very much is their writing gets small. People with Parkinson's, their writing tends to get smaller than it used to be. And that's kind of because they have a hard time with their motor movement, right? Or people will say, I can't button my shirt as well anymore. I'm having a hard time with those buttons, or I'm having a hard time tying my shoes. And it's those kind of like fine motor movements, like just hand movements, right? I can't click the computer mouse as well anymore. And these are things that you should tell your doctor about, because it could be a sign that something's coming. Not to scare you, but it's good to know, because if you know earlier, you could do more about it. Also, trouble sleeping is often a sign of Parkinson's disease. And that, again, trouble sleeping could be for a lot of reasons. It doesn't mean if you have trouble sleeping, you got Parkinson's, but if you have trouble sleeping with some of these other symptoms, then we start to think we better check this out. So what do we do to check this out? I mean, is there a test for Parkinson's? Unfortunately, no. We don't have like a blood test we can give you that says, now we know you have Parkinson's. That's what makes it hard. So like, what do we do as a doctor? How do we think about this if we don't have a test for it? Well, basically we have to try to rule everything else out, right? So there's other things that can cause motor movements. There's other diseases that can cause problems with movement. So your doctor may order some blood tests, not specifically for Parkinson's, but to make sure you don't have something else, right? So there's a lot of things you could be lacking. There's a lot of other diseases. They might do an MRI of the brain to see, is there something going on? Is it something else? And we should go through that process as doctors to make sure we're not missing something, right? To make sure we know what's causing this to happen. So the doctor would probably do some blood tests, maybe an MRI, kind of rule everything else out, but they're going to have to listen to you and your family. And I always tell people, bring someone with you, when you go to the doctor. If you're especially worried about major, condition like this, it helps. But the doctor will go through with you and your family and say the whole history. What are you feeling? They'll do the physical exam. They'll watch you walk. They'll check your muscles for rigidity. They'll have you do some things, and then they have to put it together. You have to put it together and see what's the most likely thing for this patient. So we kind of say it's a diagnosis of exclusion, meaning we got to rule everything else out, make sure there's nothing else we're missing, and then based on the clinical picture, it looks like Parkinson's. So that's kind of how we do it. Now, who would I start to think if I'm a doctor and I'm noticing some tremor? 'Cause some people have tremor and we call it essential tremor. And we say, nothing to worry about. How do we know which is which? And that's the whole big picture process. We look at the patient. People who are 60 years old or older are more likely to have Parkinson's. Now, is it possible for you to have Parkinson's in your 50s? Yeah. I can't remember how old Michael J. Fox was, but he wasn't that old when he was diagnosed.
29.
Was it? Yeah, he was thank you. He was very young. And amazing that he's, around and doing well. But he was, extraordinarily young. So we say things like 60, but we can never just have a cutoff in medicine. We can't say, well, he would never have it because he's 29. So, but we noticed too, men are said to have Parkinson's more often than women. But I was looking through some recent data, and interestingly, they said that women are they're much less likely to get Parkinson's before age 60. And I think maybe it has to do with estrogen levels, right? So, but then women go through change in life by 60, estrogen drops, and then they're more likely to get Parkinson's. So that's kind of an interesting thing that has been emerging in some of the literature. And we looked at that. Again, we don't know of the exact reason why that happens, but maybe somehow estrogen protects against it, but that's what we're looking at. So, but if women do get Parkinson's, a lot of times they do have more severe symptoms than men. Why that happens isn't 100% clear. But we tend to see more men than women, but there is like an age impact as well. All right, I think Noah's going to talk about the treatment. What do we do when you have Parkinson's?
Yeah, so I'm going to take over till the end of the presentation now. So how exactly is Parkinson's disease treated? Unfortunately, there isn't an exact cure that we can give anyone that just, rids them of the disease. So we're more stuck trying to help manage the symptoms of the disease. And we do that by using medications. And so these medications are meant to help what we call so the motor symptoms, so the tremors, the muscle rigidness and whatnot. And so there are quite a few different categories of medications that we can use. The first most often one that is started first for a person who would have Parkinson's disease is carbidopa-levodopa. And so it's actually two medications in one. The levodopa part acts as a dopamine replacement. So if you go back to pretty much the first paragraph, Parkinson's pretty much is, lower dopamine levels, which is making you have these motor symptoms. And so levodopa is just replacing the dopamine in your brain. Whereas the carbidopa portion comes in is just to lower the amount of side effects experienced with levodopa. And those side effects would include nausea, dizziness, headache, and sleepiness are the most common ones that patients will say that they experience. But this can be avoided by starting at low doses and then gradually increasing as you can tolerate it. And then other more potential serious side effects that you don't see as often would be confusion, hallucinations, delusions, agitation, psychosis, or orthostatic hypotension. So that's kind of where, say you're laying down on the couch and you go to stand up really quickly and all of a sudden you feel really dizzy, feel like you have to pass out. That's your blood pressure actually dropping for a second when you're standing up really fast. And then some other medications that we include, and these have, really long technical names. The pramipexole, ropinirole. We call these non-neurodopamine agonists. And what that pretty much means is that they act like dopamine. So they pretty much act on the receptors where dopamine would act on in the brain. And it makes the brain think that, dopamine is there pretty much. And these side effects, the side effects of these medications are a lot like carbidopa, levodopa, headache, drowsiness. These can have some stomach symptoms as well, so nausea, vomiting. Again, this low blood pressure when you're standing up really quickly, confusion and hallucinations. Now, these are normally used after the carbidopa, levodopa kind of as a second option where this one isn't the carbidopa, levodopa isn't working as well, then you add these ones on afterwards. Then moving on to some other options, so what we call monoamine oxidase type E inhibitors. These pretty much prevent dopamine breakdown, so keeping the dopamine in your brain from being broken down, not supplying your brain with extra dopamine. And just some names that you might see for these would be razidilene, safinamide, and seladelene. And as far as potential side effects with these, again, it's a lot of the same as the previous, so stomach side effects, depression, hallucinations. And then a little bit of a different one would be amantadine. So this has multiple different mechanisms of action. So a dopamine promoter is the first one, so it's enhancing the dopamine secretion in your brain, so it's pretty much not adding any extra dopamine to your brain, just helping you use the dopamine better in a better way. And then it has this anticholinergic as well, which that really does not play into, or I guess have a mechanism helping Parkinson's per se. That's just how the drug is made, and this actually adds to the side effects profile that you might experience. So when you see the word anticholinergic, other medications that work like that would be Claritin, Benadryl, so stuff for allergies. And what allergy medications do, they kind of back you up, make everything dry and slow up. And so that's more where you would see those kind of side effects from this medication potentially. So again, low blood pressure upon standing, dizziness, swelling, hallucinations, and then these anticholinergic side effects would be this constipation and dry mouth, where that would be in, because again, it's kind of slowing you up a little bit or backing everything up. And then some non-medication therapy that's really interesting we did this talk last week and someone said they actually got this and it's helped them a lot, is called deep brain stimulation. And so when you're thinking of deep brain stimulation, kind of think of like a pacemaker for your heart, except it's for your brain. And so a little device is placed kind of right here in your shoulder. And then there's wires that run up through your neck up to your brain. And it's just kind of giving your brain a little shock to help stimulate it. And one really interesting part of it is that they can actually place the ends of the wires on a certain part of the brain. So whether it be, at the front, at the back, depending on what types of things you're, I guess, dealing with Parkinson's or specific symptoms of Parkinson's disease. And they can actually try and just specifically go at those specific things with this therapy. So that's really cool. And then, but again, with every treatment that we give you, there are potential side effects that come along with it. So some side effects that you could potentially have would be numbness, tingling, problems with your balance, problems with your vision, problems speaking, and then mood changes as well. And then just in this last paragraph here, so is there anything that, can be done, or is there anything else besides medications and this therapy that can be done to help? And yes, there's plenty of things that can be done to help. So always, staying in contact with your doctor, letting them know how you're doing with your symptoms or how you're managing so that they know and they can better help treat you. Bringing a family member. So what Dr. Magri already said, bringing a family member to your appointments so that they know and they're better educated on what to do. Getting support. So there's a lot of support groups out there, and it's always better to have people around you to support you besides going and managing this alone, which we just found out today when we walked in. This place actually has a support group.
It's starting.
Or starting a support group.
Yeah.
This is Thursday, May 4th. So, yeah, if anyone is interested, flyers are up here, actually. Staying active, so it's actually thought, getting exercise, regular physical activity can actually help, with Parkinson's, because it's helping you with balance and flexibility. Then also it's helping stimulate your brain as well. Eating a healthy diet, so pretty much, that can go for any sort of, disease or just general life. Life in general, eating a healthy diet. So, but there's no specific diet out there that we tend to recommend, but generally fruits and vegetables, plenty of water, and then plenty of fiber as well. Making sure your home is safe as possible, so getting rid of, stuff on the floor, loose rugs to prevent falls, and making sure that, you don't have any cords that are going anywhere along the floor to trip over as well. And then just as a last note, if you're out and driving, just making sure to get yourself tested to find out if it's safe for you to drive, just because, it's definitely dangerous. Don't want to put yourself or others in harm if you're not okay to drive this disease.
I just wanted to say something because it stood out to me when I was a medical student. Don't be afraid to tell your doctor if you're noticing something strange. So I was on a neurology rotation and there was a woman who was like scared to death, and I ended up talking to her for a while, and she ended up telling me that she was afraid to say that she was having these hallucinations, and they were going on for a long time. But all they needed to do was change her medication and they would go away. But she was scared. She was embarrassed. She didn't want people to know. But sometimes that happens. It can happen because of the disease, but it can happen because of her medication. So I always tell people, don't be afraid to tell your doctor, even if it's something that seems scary to you, like tell us, because we want to help you. And sometimes changes can be made that really can take care of that. So, just get your regular checkups and follow up with your doctor. And that's why it's important to bring someone with you too, so that they understand.
I'm gonna add one last thing before we end. Having worked in the medical field for 30+ years and having done support groups and working with people with chronic conditions, and I don't know if this is my mantra or what, but I've always said, when you're dealing with something like Parkinson's or something long-term, in my personal and professional opinion, you need 3 things in your life. You need a positive mindset, you need a strong support system, and you need a faith in a higher power, whatever that might be. If you have those 3 things, you're going to do better in terms of day-to-day living and managing, a chronic health condition. So I just felt the need to put that plug in as well. Thank you for your time. Appreciate it.
Any questions before we wrap up today?
How do you know how to choose a neurologist to go to and be tested or whatever? Or given all of this that you've said, is it even necessary to go to a neurologist since nothing's going or can be done other than these things that you can do yourself?
Yeah, I would, okay, if you start with your primary doctor, they'll probably know someone to refer you to. You can always search on the internet, but or ask your family member to help you. It's a smart idea. I would say that it's a smart idea if you have Parkinson's, because there are different medication choices that could be made. And then the decision to, it's not going to be your first step, but someone can help guide you on how do we adjust your medications over time. And should we think about this deep brain stimulation process? That sounds a little scary, but I will tell you, with literally a flip of a switch, I have seen a patient go from looking completely, you would never think they have Parkinson's, to massive tremor. Then they show the effect of that. So the neurologist would be the one to help you decide, when is it time for that? Is this for me? And would help you get through that. So I think having a primary doctor is important for your overall health. And I would say, ask your primary doctor, who do you think of? Who should I see for the neurologist?
And also check with your community, because there are exercise supported classes, like local senior centers have Delay the Disease, which we have. There are Big and Loud. There are lots of exercise supported programs too.
Great. Thank you very much. Next month, I'll be back. We'll be talking about hearing and vision loss. And that off yet.
Could I ask you one?